Hi there, I'm going to take you through on the nursing triage, that is keying in the vital signs results after the patient has been booked. So our nursing department will be found at the departmental billing. Then we can select nursing based on your rights. So once we click on nursing, we have a waiting list that indicates to you the patients who have pending requests from other departments that need to be billed under nursing. We also have departmental patients on your right for patients who have already been billed for services under nursing. So we have patients who are in red, indicating that these patients have been queued to us and have items under nursing billed to them, and we need to access this patient and find what services they need to be accorded. So once I select my patient, I double click on the patient for me to access the billing window and find what they've been billed for. So in this case, my patient has been billed for vital signs, and I need to key in the vital signs for this patient. So I click on post all for me to access, and I click OK. So I click on that transaction that I want to enter results for. I right click on results, then enter results. So once I click on enter result, I will get a pop-up window with the nurse vital signs template, and I can tag the doctor who is seeing these patients. So once I've tagged the doctor, I can tag by clicking on the drop down and selecting the name of my doctor, or you can use quick find to search for my doctor. So once I search for my doctor, Arshad, I double click on that and I have my doctor assigned. Then I have my template, so under the results column I can key in the results. My patient has a temperature of 34, a pulse rate of 76, respiratory rate of 12, systolic at 78, diastolic at 54, weight is 45 kg. So it's very important to indicate the weight and the height for the system to calculate the BMI. So my patient is 1.2 centimeters, 1.2 meters. Then once I have indicated my results, I can enter conclusions if need be, or I can proceed to save and close for my results to be posted on the file of this patient. So once I have that, I will have the results column with a tick on it, indicating that they are results for this transaction. So if I need to get a printout of this, I can click on the vital signs, then click on the print button, and I can say I want this result. So once I click on this result, I will have a sample printout of the results that I've keyed in, indicating that I'm the nurse who has entered these results and I have approved them. So once I've entered this, it will also flag depending on the reference ranges that have been indicated. So you have various options to navigate. You have the results window, so if you need be to go to the notes, just click on the notes. Then you can see the notes of this patient for this visit, or you can see notes from all other visits. If you need to type in your new notes based on these results, you can click on new note. Then you can choose an option of the templates that have been provided, or you can type in your notes. So you can share these notes and say patient in need of emergency services. Then you can use the autosave option, which saves notes every 15 seconds, or you can save your notes manually. So if I click on save, it will indicate the date and time I saved my notes, what my notes were. I'm the one who entered the notes under a certain department, and my notes are shared. So if I need to go back to my billing window, I can click on billing and it will take me back to the transactions. If I need to bill this patient for a service based on the vital signs that I've entered, I can proceed. If not be, I can post all it, ask the patient to proceed to the doctor. So that is how you enter the vital signs for the patient and the nursing department.